If you're shopping for Medicare supplement insurance, we know you have a lot of questions. We've heard you ask, how much does a supplement cost? Can I get the coverage I need? Can I keep my own doctor? How quickly will my claims be paid? At Trigon, we've listened to a lot of your questions and concerns about health insurance, and we thought it might be helpful to give you some answers, so that choosing a supplement won't be such a puzzling experience. Let's start with the major question. How much does a supplement cost? Well, that depends. Are you buying Medicare supplement insurance for the present, or the future, or both?
It's my feeling that as we get older, we're going to need these services more, and in all likelihood, for most of us, you have less of income.
Think about your income and whether you'll be able to pay for the supplement policy now and later. In Virginia, most insurance companies determine their supplement premiums using either an issue age or an attained age rating. An issue age premium is based on your age when you first buy the policy. An attained age premium adjusts over time based on your age. Now, premiums for both of these policies will go up because of increases in medical costs, changes in federal or state regulations, or changes in Medicare deductibles and copayments. As Ann Taylor points out, these increases are inevitable.
I know that health care is going to go up. There's no way with inflation that health care would not go up. It would be virtually impossible. So that is a known and an expected.
But remember, premiums for attained age policies will also go up simply because you get older.
So somebody's going to have to do a squeeze, and that would be you.
As an example, let's look at Medicare Supplement Plan F, one of the standardized plans available to you, and see what can happen to the premiums with an attained age policy versus an issue age policy. In the first few years, an issue age policy usually costs more than an attained age policy. But as you can see, as the years pass, the issue age policy eventually costs less than an attained age policy. The chart shows that by age 75, a person with an issue age policy would have saved $1,162 in premiums over the years. If you're concerned about the cost for today, an attained age-rated policy may be for you. But if you're buying a supplement to keep for years to come, you may not be comfortable with attained age rating, and an issue age policy may be just right for you.
I think I'm being punished for longevity. You know, if I live long enough, I'll be putting all my money out in insurance.
So I don't like the idea that anybody is going to penalize me because I happen to live to be 96, you know. And in my family, that could very easily, it has happened.
Once you choose the type of premium rating you want, you can begin to compare different plans and benefits. And comparing plans benefit by benefit will help you answer the question, can I get the coverage I need? There are a variety of plans available for different needs and budgets. In 1992, the federal government standardized all Medicare supplements. So you have 10 of these plans, lettered A through J, to choose from. And each one offers you different levels of standard benefits. Plan A offers a basic benefit package. Plan J offers the most comprehensive coverage.
They had different plans that you could buy according to your income or what your needs were.
The benefits offered in the 10 standardized plans are the same from one insurance company to another. And that means you can pick the plan that best suits your health care needs and your budget.
I had options, and I selected the one that I felt that would afford me the kind of a thing that I was seeking and looking for.
However, because the benefits are always the same, people often ask, how do I choose an insurance company to buy a supplement from? Well, start by choosing a company that's financially sound and stable.
I knew them well and knew that they'd been around and they were probably going to be around in the future, and that's very important in this day and time.
Certainly, I would hate to spend a few years paying premiums to a company and find out at the time we need their services and their financial help, when a problem comes up, that they would be gone.
There are 3 important customer service questions that everyone wants answered. The first question is, can I contact someone in the company if I have a problem?
I don't know all the ins and outs of insurances. And if I have a contact person that I can go to and tell them my story and they can take care of that for me, that's very important.
You also want to know how quickly the company can handle your claims.
When we have a claim, certainly they take care of that, everything they're supposed to take care of.
Laura McKinnon knows firsthand how important claims service is.
I was diagnosed with cancer in November, and it was such a relief to know that I didn't have to worry about paying for these treatments.
You should also ask, will my claims be filed automatically, saving me the time and trouble of paperwork?
I don't have to worry about that. It's already taken care of. I have that assurance that it will be taken care of. To me, that is a company that cares about its client.
And remember, all Medicare supplements have exclusions and limitations. So you should also ask about claims that may not be covered. There are some services excluded from coverage in all Medicare supplements. And there are limits on things like dollar amounts and visits for a particular service. Also, ask if a Medicare supplement policy has a waiting period for past or present health conditions. Any medical condition you've had 6 months before your supplement policy takes effect is considered a past or present health condition. There's usually a waiting period before you're covered for that condition. Make sure you find out how long it is. Sometimes this waiting period is waived for people turning 65. A lot of people ask, do I get any added values from an insurance company? Well, you can find insurance companies that offer things like discount programs that help you pay for prescription drugs, eye exams, or hearing aids. Some companies even offer discount programs with providers who practice alternative medicine, such as chiropractors, massage therapists, and acupuncturists. And here's one of the most frequently asked questions. Do I have freedom of choice with a Medicare supplement? The answer is yes.
It gives me my choices. It allows me to choose the doctors that I have been going to for years. When I have had to use a hospital or an emergency room, I have my choice again, and this insurance covers it.
I've had some of my doctors for 40 years. They know me, and I want to stick with them until one of us goes.
While not all providers and facilities accept the amount Medicare pays, you can choose any doctor or facility for medical services. You will pay fewer out-of-pocket expenses by choosing a provider that does accept Medicare assignment. So, there you have it. We hope these answers provide a clear understanding of what you should look for when shopping for supplement insurance. If you would like more information about choosing a Medicare supplement, simply return the business reply card that we have enclosed with your video. Or call 1-800-662-2134. We'll send you a guide to choosing Medicare supplement coverage. This invaluable booklet provides in-depth information about what to look for as you shop for a Medicare supplement. It compares the benefits offered by all 10 federally standardized Medicare supplement plans and directs you to various agencies and organizations that can help you in your search for health care coverage. Call 1-800-662-2134 today for your guide, because the more you know, the more likely you are to find the plan that's right for you.